Hi, I'm Mary Lubineski. I'm a physical therapist for Orange Regional Medical Center. I work in their outpatient physical therapy department, and I'm going to discuss total joint replacements and the physical and occupational therapy needs after surgery. When you have your total knee replaced, you are going to follow one rule. You must achieve 0 to 90 degrees in 6 weeks. That 6 weeks starts from the day of surgery. It doesn't start from when you're discharged from the hospital or when you show up at outpatient therapy. It is a huge amount of work on your part to achieve this range of motion in 6 weeks. You must do your exercises every day at home and go to outpatient therapy at least 3 times a week. I will tell you that having your knee replaced and going to physical therapy is going to be quite painful, but in the end you will have a fabulous result. If you are having your hip replaced, you have 3 hip precautions that you must follow. They are set in place by the surgeon, and the surgeon removes them. They are no hip flexion past 90 degrees, no internal rotation of the operated leg, and no adduction of the operated leg. I will show you what all of these hip precautions look like. Okay, so your hip precautions. No hip flexion past 90 degrees. If this angle between my body and my femur is 0 degrees, this is 90 degrees. You cannot break 90 degrees. That means you cannot sit in a regular height chair. You cannot bend down to the floor. Adduction. If there's a line drawn right down the center of my body, you cannot take that operated leg and cross midline. That is adduction. And internal rotation is taking that operated leg and turning the foot in. A lot of people think, well, I don't worry about internal rotation because I never do it. However, if you are walking and someone calls you from behind and you pivot around on that operated leg, you have just internally rotated at the hip. Okay, so total hip patients after surgery, remember you're going to have your hip precautions, no hip flexion past 90, no adduction of the operated leg, and no internal rotation. When you wake up after surgery, you are going to have this lovely blue pillow strapped between your legs. This is to remind you of your hip precautions. The doctor will ask that you use this for 3 days while you're in the hospital. You will only be using it while you're in bed. When you're sitting in a chair, we'll put a regular pillow between your knees. After 3 days, you don't need this any longer. However, the hospital does not reuse this. This is yours. You've paid for it. Take it home. When you go home, if you're a side sleeper like most of us are, you can take this pillow, turn it on its side, place it between your knees. You can actually roll onto your side in bed. The pillow is thick enough and dense enough to support your leg without fear of breaking your hip precautions. You want to be comfortable, you want to heal faster, you want to get a good night's sleep. Please take it home with you and take advantage of it. Simone will tell you, after you're done with your hip, you can cut it up into sponges and use it to wash your car. Okay, when you have a knee replacement, some knee replacements will have a femoral block. Simone is going to discuss the anesthesia options with you. However, if you wake up in your room, and there's a whiteboard right in front of your bed, and on your IV will be a white piece of paper. If it says femoral block, what you have is a catheter in your femoral nerve, and it is bathing that nerve with pain medication. Basically, it's numbing the top thigh muscle. It's also decreasing the pain a lot. It's a wonderful thing. However, if you see that it says femoral block, every time you go to get out of bed, you must be wearing a knee immobilizer. The first day that the therapist comes to get you out of bed, they are going to place this knee immobilizer on you and then get you up out of bed. You are going to be strapped into it. It will be nice and tight and secure. When you stand up, it will support the thigh muscle so that there will be no buckling of your knee. It is very important that you be your own advocate in the hospital. If you see femoral block I don't want you getting out of bed at any time without this knee immobilizer. Your quad muscle is not working. You will fall and damage your joint replacement. If it's the middle of the night and you have to go to the bathroom and you think you can make it on your own, no, you can't. You have to have the knee immobilizer on. You're going to need somebody to put it on for you, and they're going to walk you into the bathroom. If somebody comes to take you for a test, you are going to remind them nicely, I need my knee immobilizer. I can't get out of bed without it. We do not want you to fall. Falling is absolutely forbidden with a joint replacement. You will set yourself back up to a year if you fall on that joint replacement and damage it. You want to take as much care as possible. You have spent an enormous amount of money getting this joint replaced, and you're going to work really hard at keeping it good. So, femoral block, knee immobilizer. Please make sure you have it on every time you get out of bed. While you're in the hospital, you're going to be seen by occupational therapy and physical therapy. Occupational therapy is fine motor skills. They're going to focus on getting you dressed, getting you in and out of bed, in and out of a chair, and on and off the toilet, and in and out of the shower. Occupational therapy will assess you for all of these tools that I'm going to demonstrate. This is a long-handled reacher. When you have your hip replaced, you cannot break your hip precautions, so you cannot bend down to the floor. However, if you drop something, you can just lean over, reach down with the reacher, pick it up, and place it in your hand. This is a long-handled bath sponge. When you're in the shower, you want to be as safe as possible, and you can reach anywhere in your body safely with using the long-handled bath sponge. This is a long-handled shoe horn. You can put your shoes on safely, and I will show you how to do that in a minute. This is my favorite. It does have a technical name, which I can't ever remember. I like to call it the sock putter honor. It puts your socks on for you. Okay, so in the hospital, you're going to be assessed for these lovely tools. This is a long-handled reacher with your hip precautions. You are not able to bend down to the floor because you will break your hip precautions. However, you can take that operated leg, put it towards the back, lean over, grab whatever you've dropped on the floor, and place it in your hand. This is a long-handled bath sponge. You can reach anywhere in your body you need to reach while you are in the shower safely. Our bathrooms are our #1 site for falls in our homes. We want you to be as safe as possible. So with the least amount of movement, you can clean your entire body. This is a long-handled shoe horn. It will help you get your shoes on. I'm going to show you how to do it so you don't break any hip precautions. You're going to take the shoe horn. You're going to place it on the inside of the shoe. Your hip is angled away from your body and externally rotated. Both of those motions are allowed after a hip replacement, and you can slide your foot right into your shoe. This is a sock aid. It's going to help you put your socks on. What you're going to do is you're going to take the sock aid, you'll fold it, pull your sock over these little tongues. You're going to grab onto the straps, toss it to the floor, put your foot here and wiggle, and your sock will be on. Physical therapy goals for you will be to walk 150 feet with your walker, get in and out of bed and in and out of a chair safely, and go up and down a flight of stairs in 3 days. All right, after your joint replacement, you're going to be weight bearing as tolerated, which means when you stand up, you can put as much weight as you can bear on that operated leg. I'm going to pretend that it's my left leg that is my operated leg. When you stand up, you're going to grab onto the gray handles of the walker with both hands, push down through the walker and shift your weight over onto that operated side. I want you to see how it feels. As you walk, you're going to push the walker forward. The operated leg comes forward first. You place it on the floor. As you bring your unoperated leg through, you're going to push down through the gray handles and step forward. Walker, operated leg, step forward. Walker, operated leg, step forward. All right, when you go up and down the stairs, and I want everybody to practice this at home before surgery, you're going to hold on to the handrail. Your good leg, the unoperated leg, goes up on the step first. You're holding on to the handrail. You're stepping up. You are going to continue up the stairs one step at a time, all the way up. Up with the good. When you go downstairs, you're holding on to the handrail, and your bad leg is coming first. The operated leg comes down because the leg that is left on the step is lowering your body weight. One step at a time, all the way down the stairs. Practice. The more you practice doing stairs at home this way, the easier it will be after surgery. So, here's a little poem to help you remember. We go up with the good because the good go to heaven. We go down with the bad because where did the bad go? Down. I'd like to talk about your home situation before surgery. What I would like you to do, I want you to go through your home, get rid of all the clutter on your stairs, go through and pick up every scatter rug that you have in front of the kitchen sink, by the front door. When you are home after a joint replacement, you must not fall. So you want to get rid of all the clutter, get rid of your scatter rugs, because when you're home with your walker, if your walker hits one of the scatter rugs, you could trip and fall over. Falling is absolutely forbidden on your joint replacement. It will be the worst thing that can happen, and you want to make your home environment as safe as possible. Before surgery, I'd like you to make yourself a couple of small meals, stick them in the freezer. This way, after surgery, when you're home recovering and you're hungry, you can just walk over to the freezer, grab them out of the freezer, toss them in the microwave, and you are ready to eat. If you have pets, the day you're coming home from the hospital, whoever has brought you home, you're going to ask them to go in the house and put Fluffy in another room. You are going to be on lots of pain medication and processing out the anesthesia from surgery. I do not want 40 pounds of fur flying at you while you are walking in your house with your walker. Please go into your home, get into your chair, your couch, your bed, wherever you want to go, and then Fluffy can come out and say hi to you. Before surgery, think about your home situation. If you have a two-story home, you're going to want to borrow a second walker. Typically, insurance companies will buy you one walker every 5 years. If you have gotten one 4.5 years ago, they are not going to purchase you another one. For a joint replacement, most insurance companies will not supply medical equipment for your home. A joint replacement is a temporary situation. So, if you have a walk-in shower, you can borrow a shower chair. If you have a tub shower combination, you can borrow a tub bench. All right, the most important piece of medical equipment I would suggest that you borrow is a commode. Okay, so you're going to borrow a commode. You're going to bring this commode home. You are going to take the bucket that comes with it and put it somewhere safe. You are going to bring this commode into your bathroom, and you are going to actually set this commode right over your toilet. So you now have handles on your toilet. When you come home from the hospital and you walk in your bathroom with your walker, you are going to walk over to the commode. You're going to turn nicely around. You will back up to the toilet. You now have handles to use. Your operated leg is going to come forward. You're going to lean back and sit on the commode, letting your knee bend. Take care of business. You now have handles to push up from. You want to be as safe as possible. The handles on the commode over your toilet give you that option. If you don't have a commode over your toilet and you have nothing to grab onto in your bathroom, you cannot use your walker to get off that toilet. You will be sitting there waiting for someone to come home to get you off of the toilet. If you borrow nothing else, please borrow the commode. Let's talk about your joint replacements for a few minutes. When you have your knee replaced, the amount of work and effort that you have to put into it is tremendous. You have to have the right mindset going into this surgery. You have to be ready for a lot of work and, unfortunately, a lot of pain. If you are sitting at home watching this video and you are thinking, wow, I've had a bad knee for 10 years, it is painful every day, I have that deep bone gnawing pain that I just can't get away from, you're going to do fine with surgery. If you've only had a bad knee for a couple of years, the pain is bad, the knee is bad, but you're not used to that everyday pain. You're going to have a more difficult time with your knee replacement. Knee replacements are very tough. That's the therapy end of it. You have 6 weeks to get from 0 to 90 degrees. Those 6 weeks are going to be the toughest 6 weeks of your life. The therapist is going to stretch your hamstrings, bend your knee, and feel like a 300-pound gorilla sitting on your knee to get it straight. This is what knee replacements have to go through in order to get a great knee. If you put the time into it, you work hard at home, you come to therapy, you are going to have a fabulous result. But if you have the mindset that I'm just going to go to therapy 3 times a week and I'm going to take it easy at home, you should really think twice about this surgery. You will not have a great result. Scar tissue starts to build immediately after surgery. In the recovery room, scar tissue is already building. Our job as therapists is to fight that scar tissue, but you have to fight right alongside of us. If you're not willing to put that work into it, if you can't handle the pain, please do not get a joint replacement. The results will be horrible for you. For total hip patients, you guys are lucky. There's barely any pain involved. A total hip we do not push on. We're set into the hip precautions just like you are. If the doctor sends you for therapy after surgery, it's really for strengthening. We just need to get you stronger to get you going. Total hip patients, in 10 days, you go back for your post-op visit, you'll walk in with your walker, and typically the doc's going to say, get rid of it, donate it, give it away. I don't care what you do, but you don't need it anymore. 10 days post-op. Total knee patients, you guys are going to go from a walker to a cane to nothing. It is a long process. Total knee patients are typically in physical therapy for 8 to 12 weeks, depending on how well they progress. Both of you are weight bearing as tolerated. You can put as much weight as you can take on that knee or hip as soon as you get up out of bed that very first day. You're going to start walking right away, and the knee or hip is going to feel better. It should feel better. You just had this arthritic joint replaced with a fabulous new joint. However, the work involved in getting the best result is not only up to your therapist, it's up to you. All right, I'm going to show you some exercises. The first 2 are for leg swelling. They are ankle pumps and toe curls. Diane is going to demonstrate. You're just going to pump your ankles up and down 10 times every hour when you're awake. This is especially important after surgery. As soon as you wake up, start pumping those ankles. Your leg is going to be extremely swollen, and this will help decrease some of that swelling. The next one is toe curls. You just curl your toes down 10 times every hour. These 2 motions mimic how your leg muscles pump as you're normally walking. The next exercise is a quad set. The quad is the top thigh muscle. You're going to tighten that top thigh muscle by pushing down into the bed. You're going to hold it for 5 seconds, and you're going to relax. You're going to push down and hold it for 5 seconds and relax. You're going to do that 10 times. I'd like you to do it 3 to 5 times a day. Get those muscles working. Our next exercise is a heel slide. What I'd like you to do is to use a plastic bag from your grocery store. Okay, you're going to take your plastic bag, you're going to tie it around your foot. All the plastic bag does is decrease the friction between your foot and the bed. You're going to bend your knee and slide your heel up and down. This is going to help bend the knee and the hip. For our hip replacement patients, you will not break your hip precautions doing this exercise. You're going to do this 10 times, 3 to 5 times a day. The next exercise is hip abduction. You are going to slide your leg out to the side and back. Out to the side and back. Like I said, the bag just decreases the friction. At home, your bed would be a little bigger than this, so you don't worry about falling off of the bed. You're going to keep your leg entirely on the bed, just to the edge of the bed and back. This is wonderful for hip replacement patients. Before surgery, it will loosen that hip up and get you ready for surgery. And after surgery, it will return motion to you. I have 2 more exercises for total knee patients. The first one is a straight leg raise. Diane is going to bend her unoperated leg. She's going to point her toes of the operated leg to the ceiling. She's going to tighten this top thigh muscle and lift that leg straight up and down. You're going to do this 10 times, 3 to 5 times a day before surgery. Before surgery, I want you to do both legs. Make them as strong as possible before surgery. The last exercise is probably the toughest exercise for total knee patients. It is the hardest one for you to do because it will cause you pain. I always ask that you have someone that loves you very much help you with this exercise, because when you start yelling and screaming at them because of the pain, they won't leave you there. You are going to take a towel and you are going to roll it up in a roll. You're going to place it under the heel of the operated leg. This creates a space. This creates a space between the bed and your knee. This space allows gravity to pull on that knee, helping it to go straight. What I want you to do is 5 times a day for this exercise, up to 1 minute. Whoever is helping you with the exercise is going to watch the second hand of a clock. They're going to time to see how long you can stay there. After surgery, if you can spend 20 seconds on this towel roll, I'll be thrilled. Every time you get on the towel roll, we're going to try to increase that time, but no longer than 1 minute. It's better for you if you do up to 1 minute 5 times a day. If you think you're going to sit there and you're just going to do 5 minutes once a day to get this exercise over with, after about 45 seconds, the pain is going to become so intense that you will start bending that knee up and tightening it and holding it there, creating this big bend in the knee. You are not doing yourself any service. You want to let gravity pull down on that knee and get it as straight as possible. So, 5 times a day, up to 1 minute. Those are the exercises I want you to start before surgery, and after surgery, I want you to continue those exercises. Thank you. Okay, so when you go home from the hospital, I'm going to show you how to get in and out of the car. It's a little challenging, so after this video, I'd like everybody to practice. Most of us are drivers nowadays. We don't even like getting in the passenger side. You will be sitting in the passenger side. You will not be driving yourself home from the surgery, and you will not be driving for a while after surgery. Okay, so when you're going to be discharged from the hospital, the person who's going to pick you up, they're going to take the passenger seat of the car. They're going to slide it as far back as it will go. Then they're going to take the backrest and they're going to recline it all the way down. Okay? So when you're discharged from the hospital, we'll bring you out of the hospital. You will walk over to your car with your walker. You will make a small turn. Tiny steps. There is no pivoting on your joint replacement. You're going to turn completely around. And you're going to back up until you feel the car behind your legs. Diane's left leg is going to be the operated leg. Diane is going to bring her operated leg forward. She is not going to grab onto the door because it moves. She is not going to hold on to the walker because we don't want that to slide away from her. She is going to take her right hand, grab onto the post of the car as low as she can. She is going to let go with her left hand. Let go with her left hand. Oh. She is going to sit on the seat, keeping the leg out, protecting her hip precautions. As soon as Diane is on the seat, we will take that walker away. Diane is going to scoot herself back on the seat. She can let her knee bend because she is a total hip patient. Let your knee bend. There you go. Okay, she's going to turn and bring her leg and help her leg into the car. She's scooting on to the backrest and getting herself into the car. Once she is in the car, she will pull the backrest up, put her seatbelt on, and go home. When she gets home, she's going to do it in reverse. All right, total knee patients, you guys don't like to bend your knee because it hurts when you bend your knee. So you typically sit with your leg out straight. You are also going to scoot yourself onto the seat and onto the backrest. However, because you're holding your leg straight, you are going to hit the door. Okay? What I want you to do is you're going to take both hands. You're going to grab right above your knee. You're going to pull your hip up. You see what happens when you pull your hip up? Your knee automatically bends. You will pull that hip up and you will whip that leg into the car because yes, it is going to hurt, but you will be in the car. After you're in the car, you're going to pull up that backrest, put your seatbelt on, and go home. When you get home, you're going to do it in reverse. You're going to lower that seat rest, scoot yourself all the way onto the backrest. Turn and get your legs out by lifting your hip up. This is for total knee patients only. Total hip patients are not allowed to pull up their hip. Okay, well, thank you for listening to me talk about total joint replacements and the physical and occupational therapy you will need. But please remember, joint replacements are a serious thing. You have to be prepared for them. You're going to put a lot of work into it, and it costs a lot of money to get a joint replacement these days. You have paid for this by working all of your life. Your insurance is going to cover it, but you paid for it. Get the best result you can by working really hard at it. If you have any questions or concerns after watching this video, feel free to call me. I work Monday through Friday. I'm available anytime. Thank you very much. Absolutely. You will be able to do that no problem. It will take a little time, but eventually you will have enough range of motion where you will be able to bend your hip and your knee appropriately to get the shoes and socks on. Okay, you are going to be walking the day after surgery. Physical therapy will come and get you up out of bed, and we will take our first few steps after surgery the following day. You are going to start walking right away. Yes, you absolutely have to follow your hip precautions. They are set in place by the surgeon, and the surgeon will remove them when he feels they are ready to be removed. Typically, somewhere between 6 and 13 weeks, he will remove them, and then you'll be able to do anything you want to do. But until that time, you must adhere to your total hip replacement precautions. Physical therapy after surgery is very subjective. It varies for each patient. It depends on how much range of motion we get back, how strong we get you. Somewhere between 6 and 12 weeks is probably typical for a total knee replacement. The more you work at home, the quicker you will end therapy. Okay, driving following surgery is cleared by the doctor. If you are a total hip replacement, you're going to drive sooner than a total knee patient. If your left leg is leg operated on, you will drive sooner than someone that had their right leg operated on. Before you go in to ask the surgeon if you can drive, remember two things. If you are still asking for pain medication on a 24/7 basis, he will not clear you for driving. Driving on pain medication is a DWI. The other thing he's going to look for, especially for total knee patients, can you sit and stand with no hands? If you can sit down in a chair without using your hands, and you can stand from that chair without using your hands, he will clear you to drive. He knows you have enough strength in that leg to stop the car, and that is what he is most concerned with. Okay, taking a bath or swimming has to be cleared by the surgeon. So you're going to have to talk to him. It will probably be a while. They want everything nice and healed before it is submerged in water. Stopping the usage of your assistive device is very subjective. If you're a total hip patient, you will have your assistive device, the rolling walker, for 10 to 14 days. Then you won't need it anymore. If you're a total knee patient, you're going to go from a rolling walker to a cane to nothing. The progression of that depends on how much work you're putting into it, how quickly your range of motion is coming back, and how strong you are.